Thank you, Keydella, for joining us today with Pearls for MPs. Can you tell me how you work as a cardiology MP, why you got started in cardiology?
Sure. I'm Keydella Fuller. I'm a cardiology nurse practitioner. I also own a wellness company called Fuller Health and Wellness. I got into cardiology because my father has always struggled with heart issues, and I just wanted to learn more about that and how to help him help himself.
Okay. Can you tell me what are your responsibilities you do as a cardiology nurse practitioner?
Sure. So I work currently in an outpatient setting, seeing patients coming in as new patients or follow ups, and really doing head to toe cardiology. It's also not just stress testing and seeing patients for chest pain, but we also do vascular testing, looking for peripheral artery disease, carotid stenosis. We do echocardiograms, stress testing, cardiac MRIs when appropriate. So, really just treating the head to toe cardiology needs.
Nice. And then can you just tell me more about your business?
So, my business is taking on a holistic approach to helping people manage their anxiety, depression, and chronic fatigue, really just teaching them how to restore their energy naturally and balance their mood with sometimes less prescription medication needs.
So how would someone who has anxiety who doesn't want to take medication, how would you manage their anxiety?
So it's different for everyone. It's really personalized. First, it starts with trying to figure out the root cause of the anxiety. So, what's driving the anxiety? So, we take a really comprehensive history and we do some personalized, different testing than what's done traditionally, and just really trying to identify, is there toxins that are, being a cause and interfering with how our body responds? Is it imbalanced gut, imbalanced microflora, or is it bacterial overgrowth, yeast that's causing some of these interruptions in the neurotransmitters that we produce in our stomach, in our gut?
Nice, because not all patients want to take medication. Medications, cause a lot of side effects. Do you have a patient in mind who you've helped manage their chronic condition and, they love the holistic approach?
Oh, so yes, actually, more so, this particular patient was really struggling with a lot of depressed moods and just chronic fatigue, having a hard time getting up out of bed in the morning, like literally needing to wake up an hour before he needed to get out of bed, take Adderall, go back to sleep for it to kick in and really get that wake up and go drive. On his particular lab testing, turns out he had some environmental toxicity that he just wasn't excreting from his body properly, as well as just really poor mitochondrial health. And we know that's where our energy sources are from. So just really working on restoring that mitochondrial health, detoxing those toxins from his body, and just supporting him with the nutrients that he was lacking really just made a difference. He's waking up a little bit easier in the morning. He's not dependent on 5-hour energy drinks and not even drinking caffeine anymore.
Oh, wow, that's amazing. Oh, nice. I gotta look into this holistic approach thing with my
Yes.
yes, I need to. Girl, I know I gotta call you. And then I guess my last question is, what is your advice for new nurse practitioners?
Definitely don't stop learning. Don't limit yourself. If you're in a field that you're not really excited about, then move on to something else. Sky's the limit. Nowadays, we're getting more autonomous in more states. So really pick something that you really enjoy so that way it doesn't feel like work when you go to work every day.
Yeah, that's great advice. Thank you so much, Keydella, for joining us today.
Thank you for having me.
Thank you.